Today, we have a distinguished guest named Dr. Suhail Khursheed, who holds a PhD degree in what is actually the anesthesia is.
Anesthesia is a branch of medical science. In that we are dealing critical care patients and during surgical procedures.
Like for becoming an anesthetic or an anesthesiologist, what things a student have to do in order to get this degree?
Student for any almost medical professions, the student has to complete first of all, after completing second PU.
Before any shooting the podcast, sir, we are making one survey through the Google Forms, and that we get the many questions. The one of the question is, sir, what things actually differentiate the machines and the human? I mean, human sensation have any role in the medical science? Hello friends, it's pleasure to have you back on the channel of Clinical Care Insight. Today we have a distinguished guest named Dr. Suhail Khursheed, who holds a PhD degree in anesthesia. So we will talk about the anesthesia in our today's podcast. As we know that medical science offer the specialities which is basically essential for both for the practitioner as well as the patient. Okay. And as we delve deeper into the field, we become, you can say, amazed, we become surprised, okay? And also we have the questions. As I believe that if these questions are answered by an expert, then it will greatly enhance our understanding process. So sir, can you please introduce you briefly about yourself and your background?
Hi Ram, thanks for inviting me. So my name is Dr. Suhail. I have completed actually I am from Kashmir, so I completed my basic qualifications, the school and primary qualifications in Kashmir only. Then for the higher this education, I went to Bangalore. So then Bangalore, I completed my UG there in anesthesia, and then I went for PG in Punjab. I completed my PG in Punjab, and then I went for PhD in Tamil Nadu. I completed from Tamil Nadu my PhD. So now I am having a specialty of anesthesia right now. And right now I am teaching in Dhanvantri Institute of Allied Health Science. I am in charge vice principal also there. So I teach anesthesia and operation theatre related subjects.
Okay. So sir, my first question is, what is actually the anesthesia is?
Anesthesia, it's a branch of medical science. In that we are dealing critical care patients, and during surgical procedures we manage the pain and the respiratory airway system. So we give anesthesia to a patient for doing any kind of procedure. So two ways are there. First one, when you are doing any surgical procedure, for that it's important to give anesthesia, and anesthesia is explained under the parts. So before anesthesia, during anesthesia, and after anesthesia. And it has also one more part that is called as pain management. So we have to manage the pain. Whenever you get any kind of patients in your hospitals regarding any kind of harsh or serious pain or any kind of accidental injury, so that time the first thing what we do is pain management, and then it comes into critical care. So critical care is also one of the important field in the anesthesia which an anesthesiologist is dealing with. So in critical care we get many kind of patients accident. As we can see, most of the emergency cases come in accidents or any cardiac arrest, heart attack or anything. So that time we need a critical care person. So in hospital many medical doctors will be there. Out of that medical doctors, an anesthesiologist is classified into the critical care unit because it is mainly for critical care and pain management. The second part of that is when you are performing a surgery, when you are planning a surgery. So in that, to perform surgery, to give anesthesia. Anesthesia is the main important thing for the surgery. A surgeon, when he is planning of surgery, he has to go through the anesthesiologist first. Once an anesthesiologist will approve and fitness for the patient that he is fit for the surgery, then a surgeon can go for a surgery. And it is done by a lot of things, a lot of observations, a lot of diagnostic procedures a patient has to go through, that we are checking. Like for example, blood reports we will check whether the patient is having a previous medical history, surgical history. So a lot of things we are checking.
Okay. So you use the one term anesthesiologist, and there is another term that is called anesthetic, and lots of students have the confusion. They both are same or they have the different perspective or idea?
It is very different. It is very different.
How?
Both of them are medical practitioners, but an anesthesiologist is a medical graduate, that is MBBS.
MBBS.
He is anesthesiologist is an MBBS, and after completion of MBBS, they have to go for a specialty course. Either they will go for normally for MD. After MD, they need 4 years of fellowship in anesthesiology, and then that is called as a certified anesthesiologist, which can independently do a surgery.
Okay, and what's the role of anesthetic?
Anesthetist is it is also a medical graduate, but it is not MBBS. Understood? It can be a bachelor of anesthesia. Understood? It can be anyone who is bachelor of nurse also, who has completed his bachelor's of nursing, and after that they have to do one special course, that is anesthesia. If it is nurse, understood. But if it is an anesthesiologist only, anesthetist only, then what anesthetist will do? He will be completing his bachelor's, then he will complete his master's, that is 2 years, and then after that he will go for a fellowship or internship after the masters. Then he is actually the assistant to the anesthesiologist, and not only assistant, but he sometimes independently can perform like anesthesia, like for small procedures, not a special procedure planning of surgeries. Also have different parts, different types of surgeries. Some surgeries need little small types of anesthesia, which are called as regional anesthesia. Understood? Or you can say local anesthesia, which we are locally using when you are, for example, if a patient is having any surgery in the hand, understood, in the finger, understood. So for that we will not do general anesthesia because it's just a part. So we will block a nerve here, we can perform, we will make this part only unconscious. So that is local anesthesia. So that anesthesia an anesthetist can give, but under the supervision of an anesthesiologist, because anesthesiologist is independently can give anesthesia.
So surgery reminds me one thing. I was posted in one hospital, and I was in in major OT. So I am witness of the one operation, one surgery that is called as split thickness skin grafting. What is happening? A patient skin from the thigh is grafted and harvested in the wound area, wound region.
Yes.
So I seen that before doing this procedure, one anesthetics came and they injected one spinal block. Spinal block. So what is actually happening when one patient is administered to the anesthesia, exposed to this anesthetic agent? What is happening in their body?
See what happens actually when in anesthesia. What happens? Anesthesia, first of all, is a branch of medical science. Under that, there are subspecialties, and in anesthesia, there are types of anesthesia. It can be explained under the conditions the patient is. For example, if a patient is having need as a special surgery, so for special surgery or big procedure which takes you a long time, for that general anesthesia we are giving. What you told is your skin grafting, what you have witnessed in the operation theater, that is in that we do local anesthesia, understood, or regional anesthesia. It depends upon which part is involved. See, for example, if you are involved, if a patient is going through lung surgery, any open heart surgery, or any orthopedic surgery which takes more than 4 hours, so we will go for general anesthesia. But if it is a small procedure, if it is less than 2 hours or it is below umbilical region in your lower body, so it will be easy for us to give a spinal anesthesia, because in spinal anesthesia what we give, we will introduce anesthesia in L3, L4, in the lumbar area of our spinal cord. There's one needle also, in that needle is 24 gauge needle that we insert into L3, L4, and then we are introducing anesthesia. And in that, what happens, our lower body only, our lower extremity, lower limbs only will get unconscious, anesthetized, below umbilicus. So that we are normally using for gynecological procedures also, because gynecological procedures last less than 2 hours only. Whether it is cesarean section, whether it is hysterectomy is little more time taking than the cesarean. But we use spinal anesthesia only for that. But patient will be communicable. The patient can talk to you. So you can talk to the patient, you can have conversations with the patient that what you have eaten yesterday.
I seen. Doctor is continuously checking his conscious level once injected with the spinal anesthesia. Yeah, doctor is checking.
We use, like I told you, in the below umbilical regions, what and all surgeries you are going through. So in that we use spinal anesthesia. In spinal anesthesia in gynecology, I told you cesarean section is there, or else hysterectomy, what and all gynecological procedures. And other than gynecological procedures, also in your lower limbs, any lymphs are there, lymph nodular problems are there, your inguinal lymph nodes, or any other problems like you told, grafting, or any in the feet, any problem is there in the lower limbs, we can do that anesthesia. There's no need to unconscious full body. And that general anesthesia, there's a big difference between general and regional. Because general anesthesia, when you are giving, you are fully anesthetizing the patient. The patient is completely unconscious.
Means their conscious level is completely
Conscious
blank.
level is completely not there in general anesthesia. But in regional and local anesthesia, patient can communicate with you. Patient can talk to you. You can have conversation with the patient. But only the thing will be, patient will be having block into the special part where you are performing the surgery. That part will be anesthetized.
Means like you are saying, for minor operations we are using the local anesthesia,
Yes.
and for major we are using the general anesthesia.
Yes. Yes.
So yes sir, for what is happening actually in the, as you said, that it take away the consciousness of the patient. It means it's not only blocking the pain receptor, it is blocking other things also. So what's the mechanism?
The mechanism is that when you are performing any kind of surgery, when we are performing any kind of surgery, when a patient is going through a surgery, then what we do is, that is called as PAC, pre-anesthetic checkup. It's called as PAC, pre-anesthetic checkup. In pre-anesthetic checkup, we check patient's everything, medical history, all, whether he has gone through any surgery before, whether he is on medication or anything. After that, there will be planning of anesthesia, which anesthesia will be suitable for the patient. Sometimes what you told is, if a patient is having any kind of medical history, so for that patient, we can change the anesthesia also. It is not important that if a patient is there, so for this type of patient, if surgery is for lower umbilicus, so you will give local anesthesia only. It is not important. We have to check the patient's history also, whether he is on medication. If he is on medication, it will allow us to change anesthesia from one to another. Because there are types also. See, in that general anesthesia, we are giving inhalation anesthesia that comes through a anesthesia machine. Patient is fully ventilated. So that is the difference in the general anesthesia and in the local anesthesia. But what happens unconscious level? In your local and regional, the patient is conscious. Only the part where you are performing the surgery is unconscious.
Okay. And so how are you determining the dose?
We are determining the dose according to the age, according to weight. Age is the main factor. Weight is the main factor for determining the type of anesthesia. And I told you medical conditions. If a patient is healthy enough, he has not gone through any surgery previously, or he is not onto any kind of medication, then surely we will go through a basic type of anesthesia which we use. But if a patient is special, that's called a special type of patient. If a patient is having any kind of medical history and all, that will allow us to change the, this type of anesthesia.
I mean, like suppose if patient is alcoholic, a chronic alcoholic,
Chronic-
it interfere with the anesthetic dose.
So it will be, that's what. Lifestyle also has an impact on this, because if a patient is a smoker, if a patient is prolonged smoker, a chronic smoker from last 40 years, 30 years, or a patient is taking alcohol from last 30, 40 years, so definitely alcohol will have a lot of its impacts on the health. Understood? So after that, because alcohol will have mostly impact on liver. Liver is the most common organ which has more impacts of alcohol. So, and liver is also an important organ of excreting drugs. What and all medicines you are eating, whether it is oral medication or IV medication, whatever medication it is. So liver only is excreting that. So it means that if a patient's liver is involved in any kind of disease, so that will also allow us to switch from one anesthesia type to another anesthesia type.
Okay. And so like what are the side effects of anesthesia?
Side effects is the most common question people ask about anesthesia, that anesthesias are having side effects. Most common type of side effect which we all have gone through, which all have known, that is nowadays they are telling amnesia. Amnesia happens because
What is the meaning of the amnesia?
amnesia, first of all, is memory loss. Whenever you lose kind of memory, that is important for anesthesia. See, you told about anesthesia. I will tell you one thing. Before anesthesia, before a patient will go through a surgery, we are giving some medications.
Priorly.
Before the anesthesia, before we are preparing the patient for a surgery, we will give some medicines. We will give some medications that are called as pre-anesthetic medications.
Pre-anesthetic.
Because see, if a patient is there, he is going through a surgery, definitely he will be, anxietic. Understood? He will have stress. He will have a kind of depression. He will think, what will happen if doctors will perform my surgery? What will happen to me? Understood? Whether I will die or something. Like kind of fear will be there. So for that we will give medicines. We will give anxiolytics first, that are called as pre-anesthetic medications. We'll give anxiolytics so that the patient will not have any kind of depression, so that the patient will not take any kind of stress. Understood? We give a lot of medicines rather than that. We give, if you see any kind of patients having fear of surgery. Understood? So for them also we give kind of medicines which will take them away from that fear.
Amnesia, sir. You said that one of the drawback of anesthesia is amnesia. I mean, why it is happening, sir?
That is, peoples are asking about that. Peoples will say this is the kind of side effect for anesthesia, but it is not medically that much proven. Only amnesia will be there when you are performing a surgery. We will make patient will be in general anesthesia. The patient will have to go through amnesia, because general anesthesia means patient is fully unconscious, completely unconscious, and amnesia is that time. Amnesia is very important because there are types. If patient is unconscious and amnesia is separate thing. In unconscious state also, sometimes you recall some things. You are sleeping. What does sleeping mean?
Like complete detached from the environment.
Detached from the environment. That is also, you can say, a kind of unconsciousness. Understood? But the unconsciousness while sleeping and the unconscious when you fall on the ground, that are two different unconscious states.
That is different.
That is different.
I studied these things, sir. That the sleep, normal sleep and induced by the anesthesia is different.
It's different. Normal sleep, unconscious means if we will make you awake, you will get awake. But that unconscious means we have relaxed your muscles by the medicines, by the drugs. Muscle relaxants we will use analgesics. Understood? We will use for amnesia. We will use opioids. We will use benzodiazepams. That are the pre-anesthetic agents that are called as sedative drugs. You will go in sleep. You will go in sleep. So that is different. In the anesthesia, that one, when you are giving sedations to someone, means you are making him to sleep. It is not a normal physiological sleep.
It's a different.
It is different. By medicines, we are inducing the sleep. We want the patient to be asleep, and we want the patient should have amnesia, because when you are performing surgery, a lot of conversations happen between the doctors, because as in the operation theatre, it's a teamwork. The surgery is performed by a surgeon, an anesthesiologist. With the surgeon, an assistant surgeon will be there. With the anesthesiologist, an assistant anesthesiologist will be there. Like what you told is anesthetist. Anesthetist will be there. And after that, there will be nurses in the scrub side which are helping the surgeon in the surgery. And after that, there will be some technical staff which are maintaining the machines over operation theatre, because operation theatre is fully equipped with a lot of instruments, a lot of machines. And rather than that, more than that, we have one circulatory nurse also there.
Circulatory nurse.
Yes, which whenever you need anything, so you should go and immediately you should bring the things. So it's a teamwork.
Means you are, sir, saying basically that this amnesia is needed. It's needed during
the reason why amnesia is needed in the surgery. If, for example, this is a question why amnesia is needed in the surgery, that is for psychotic problems. Because if you are awake, your conscious level is there in the operation theatre, and you are listening what doctors are having conversation, what sounds are coming from the machine, all that. So that will give you a psychotic trauma.
Oh.
That will give you a psychotic trauma, because after the surgery you will always remembering all that things. And in fact, if the amnesia will not be there, then definitely if you are hearing the conversations between the doctors and other that harsh type of sounds, you will, and automatically it will impact your autonomic nervous system. Your heart rate will get increased. Your blood pressure will get in. No matter you are unconscious, but it will happen because you will think. Have you observed when you are sleeping in the night and you will have a dream? In dream also you are sleeping. You have not done any activity, but still, if you see something like someone is attacking on you, your heart rate will be increased. You will get a kind of sweat. Have you observed that?
Yes, yes.
If you are sleeping, your body is in the unconscious level, kind of unconscious level. Why your autonomic nervous system gets impulses? So this is,
sir, amnesia is a good thing for anesthesia.
It's a very good thing that without amnesia we will perform the surgery, but small kind of surgeries, but not general.
Yes, then it is not considered as a side effect.
No, it is never a side effect. It is very important for a surgery. It is for the recovery also. If you don't know what happened to me past 2 hours, you will go through the flow. You will go with the flow. But if you know there was some accident happened, so it will be in your mind. So it helps in recovery also. If you are free, then recovery will be quick.
Okay. And sir, what if the dose will exceed, like overdose? What happens with the patient? It can take away the life of a patient.
Overdose means most of the cases. See, everyone, as you are also a medical professional, you also have heard about these things that somebody died because of overdose of anesthesia. Yeah, it is there. It is there because if overdose is there, first I will tell you about overdose. Overdose means when you are giving more than the requirement. When your dosage is more than the requirement. Now, for example, if it is going more than the requirement, then what happens? Patient will surely die. If it is more, if patient will not be able to tolerate that, yeah, there is no medicines. Yeah, but we have reversible agents. When a patient is anesthetized, after you complete the surgery, you will give reversible agents. Reversible agents is called as the antidotes.
Antidote.
That is actually antidotes,
Okay, which can reverse back the.
which will take reverse back the conscious level of the patient. They take the conscious level back of the patient, and in that we use reversible agents. Reversible agents, in that we use against naloxone is the one of the tablets, which you are medicines which you are giving, or else if it is general anesthesia, if it is a big procedure there, then patient is unconscious, so you need infusion. So in the infusion also you will add neostigmine is a medicine which will improve your muscle strength, means your muscle consciousness will be there because you have anesthetized the muscles. Now what happens because of that? Neurotransmitters, because if you have pain in the feet, that has to reach to the brain first. Understood? Because brain will allow you to feel, and how it travels through your nerves. Understood? So with that medicine, with that pre-anesthetic drug or medicine, we block that, so that pain should not reach to the brain. Pain should not at all come to the brain. So that is called as analgesics.
Analgesic.
Yes.
Means basically anesthesia provide the analgesic effect, muscle relaxant, as well as the amnesia. And amnesia is not a side effect. It's like a good thing for the patient as well as to the surgeon.
Yes.
So the another thing is, suppose we given the dose, okay, patient is like going in an unconscious state, and we start doing the procedure. Okay. But suppose patient feel the pain, then in that circumstances, what we will do?
In that, what happens? Actually, we have anesthesia machine. If a patient is on general anesthesia, the patient is on ventilator. Understood? That's called as mechanical ventilator. Anesthesia machine. Also, you can call it as Boyle's apparatus. Earlier it was Boyle's, now it is anesthesia machine. Now we have modern machines also. I will tell you about that. If in between, in the middle of the surgery, you feel a kind of sensation from the patient, so what we will do? We will increase the dosage of the anesthesia.
That's one.
We will increase the dosage of the anesthesia, and if you see any movement, patient is anesthetized, but there is some movement, then we will give, as I told you, we will give muscle relaxants, so that we want muscles to relax. Understood? We will give anticholinergics. Understood? Cholinergic receptors we will block. Understood? So that information should not come from any part of the body. Understood? Actually, what happens? You have to unconscious the full body. So how you unconscious the full body? You have to unconscious the nerves. In general anesthesia, we suppress the feelings of your nervous system only. We suppress the brain only. So nothing reaches to brain. Mainly, nothing means don't understand, treat is nothing as wrong. Nothing means just pain.
Just pain.
Just pain and sensation. Other things will reach. See, blood circulation will go. Understood? Other things all will go. Only nerves, we are blocking just the nerves.
That's why, sir, it says that in many research paper, for preparing this podcast, I was like studying the one of the paper, and that paper is saying कि anesthesia only take away the memories, not getting the patient in a full unconscious, which is a partial unconscious.
It is if we make patient fully unconscious, completely unconscious. In complete unconscious, see, unconscious is also unconscious under types. It is there. Partial unconscious, what you told. If a part of body you have to unconscious, if fully body you want unconscious. So there are some types. In general anesthesia, full unconscious is there. Full body is anesthetized. And in regional and local, a region of a body is anesthetized.
Okay. So like anesthesia is a blessing for a like a patient. It's a tremendous blessing.
It is important. I should tell you because early, first of all, anesthesia, introduction of anesthesia. Anesthesia takes a lot. It is a top paid job also. Anesthesiologist is a top paid job also. Why I am telling you like this? Because it's a specialty. In all kind of surgeries, you need an anesthesiologist. You need an anesthesiologist. And not only anesthesiologist does not work only in anesthesia. It works in critical care, it works in emergency, it works in any kind of emergency in the hospital. Whether it is not only limited to hospital, outside the hospital also, in case of any natural disaster. Because anesthesiologist is also a critical care person. So that is why anesthesia is very important. And for maintaining surgery, it is very, very important. Until and unless an anesthesiologist will not give, after the pack, he will not give reports that this patient is fit for the surgery, a surgeon can never perform a surgery. That's also a fact. Because surgeon perform a surgery only if an anesthesiologist will give confirmation, yeah, he is fit for the surgery, you can perform surgery on the patient.
We discussed about the overdose effect of anesthesia. Sir, one of the questions I get from our viewers, from the audience, and that is, sir, how to manage one complication that is called as malignant hyperthermia, and what it is actually.
This is a good question. Actually, malignant hyperthermia is a critical and rare emergency in your operation theater, which happens. That is, in that case, malignant hyperthermia, what happens actually? It happens because of sometimes volatile anesthesia. Volatile anesthesia, you must be understanding that general anesthesia, we use mechanical ventilators. Through mechanical ventilators, we give anesthesias like isoflurane, gaseous type of anesthesias. That are called as volatile anesthesias. Like isoflurane, desflurane, we have sevoflurane, we have. So during that, when there is little more, either it can be, cause can be increased dosage, or because of if it is not good for the patient or it's not comfortable for the patient, for that type of patients, it can be a problem. It can lead to malignant hyperthermia. So what happens in this malignant hyperthermia? A muscle stiffness will happen.
Muscle stiffness.
Muscles will get strengthened. Understood? Rigidity of muscles, and temperature increases. Way. Sudden interruption of increase in temperature will happen suddenly. And what happens in that? We have to stop. If you see any kind of malignant hyperthermia patient, when you realize that the patient is going into the malignant thermia, what happens? You should first stop the dosage of anesthesia, first of all, because the main root cause for malignant hyperthermia is your volatile anesthesias. Understood? Volatile anesthesia. What you have to do is, you have to cool down the patient. You should need some ice cubes. Understood? And some cool blanket will be also there, which will make the patient cool. Because so in malignant hyperthermia, the temperature exceeds. It happens more than 40 degrees Celsius. And if you see in Fahrenheit, it will be around more than 100 Fahrenheit. Understood? In malignant hyperthermia. So your main concern should be to cool down the patient. So what and all ways will be there? You have to cool down the patient. The patient's temperature should come down. And in that you should stop the anesthesia. That is also important. You should reduce the dosage of the anesthesia, or else you can stop the anesthesia. Understood?
Yes. That is malignant hyperthermia, and it is preventive.
It is preventive. But it's a critical and rare condition. Rarely it happens, and critically it happens. When it will happen very clear.
And so generally one thing, like patient is advised to not take the food, like fasting. Why it is needed?
Fasting is very important. When you are introduced to anesthesia, when you are going into the surgery, fasting is very important. Now, why fasting is important? Because of gastric irritations. When you eat something, because digestion has to happen, right? So if you will eat something and you are undergoing surgery, so your stomach has to work, right? So if it works, you will feel kind of vomiting. Understood? So then we have to do aspiration. So all that, to get away from all that things, we tell patient to have a fast. According to the World Health Organization, or else the anesthesia teams or anesthesia departments who and all are working into the field, according to them, there should be, for solid wastes, solid foods, there should be 6-hour fast. 6 hour fast, and for liquid there should be 2 hour fast. If it is more, that is good, efficient, because that will allow us to have a smooth surgery, and have a smooth induction. Induction means to introduce the anesthesia.
Means mainly doctors are advising just because of preventing the gastric irritation,
irritations,
as well as to
preventing-
smooth
Yes.
exposure of anesthesia.
Yes.
And sir, there is one very interesting question which I get from the audience, and that is, sir, how interesting is the field of anesthesia for those practicing it daily in a hospital setting, and how safe is it for the practitioner themselves?
This is very important question, because see, doctors all over their entire career, entire life, they will be working for humans, they will be working for the mankind. But it is important for us to take care. All the health professions who all work in hospitals, it start from the doctors, start from the paramedic staff, nurses, all that who are associated with the hospitals, they should take care. And moreover, the doctors, because more load is onto the doctors. The doctor who is performing 6 hour, 7 hour surgery, there is a lot of workload, a lot of mental pressure is there for the doctors. Because see, if you stand for a long time, like 4 hours, if you stand, then muscle stiffness will be there. Understood? Sometimes a lot of pain will happen because of standing. Understood? Until and unless you not do any kind of movement, blood flow also gets some kind of restrictions and you get pain. So all that things, and there should be some counseling sessions also for the doctors also.
Counseling section.
Counseling sessions should be there, because you should keep counseling the doctors to be very strong mentally, because an anesthesiologist especially has to make rapid decisions very fast and very quick. He should have the capability of making decisions so fast. Understood? And he is associated with a team. It's a team. There is a team of paramedics, there is a nurse, there is a surgeon, assistant surgeon. Understood? So rapid decisions and all should be there, and the team will get exhausted because of prolonged work. And doctors will never hold a patient, because whenever it's emergency, they will not tell, I am tired, I am like this and that. So for that, kind of counseling sessions should be there, kind of relaxation should be there, proper this PPE kit should be given, because they will be introduced to the patient, and patient is having disease. Understood? See, for example, hepatitis, HIV, all that patients come to hospital. So for that, a proper equipment set should be given to the doctors.
So these are the precautions,
These are the
measures.
precautions which everyone who is associated with the hospital should take. It is very important. First, to maintain the health of yourself, maintain the hygiene of yourself, then you are introduced to the patient. Because in hospital, it's this operation theater, it's all sterile environment.
Hmm.
Understood? So in this sterile environment, you have to be very, very conscious about hygiene.
Sir, as we are before any shooting the podcast, sir, we are making one survey through the Google Forms, and that we get the many questions. The one of the question is, sir, like for becoming an anesthetic or anesthesiologist, what things a student have to do in order to get this degree?
Student for any almost medical professions, the student has to complete, first of all, after completing second PU, then he has to go for any medical course. If he wants to be anesthesiologist, then he has to go to medical school. That is MBBS he has to do first. The basic undergraduate program, that's MBBS. After MBBS, he has to go for MD. MD course. It is also 2 years, and after that some fellowships and all, it completes within the 4 years. After 4 years, he has to go for another fellowship for at least 2 years, that is working with the anesthesiologist. He has to work with the anesthesiologist, the senior anesthesiologist. Then after completion of all that years, after completion of MD and after completion of 4 years of fellowship, then he can independently give anesthesia. He can perform independently surgery. So, and anesthetist should be same second PU. After second PU, he can join any allied health college, which is also a medical college, or you can say paramedics also. It is paramedics, yes. He can do bachelors of anesthesia. And after bachelors of anesthesia, it is also a 4 years. Then after that, 2 years of masters, and after that 1 year of internship or 2 years of internship. Then he can perform with the anesthesiologist. Helpers are there, anesthetic technicians, some nursing staff, they will be there also. helping with the anesthesia department, they will be towards the anesthesia also. They can also, if a bachelor of nurse is also there, if after completion of bachelor in nursing, then after that she will gain the experience, that is fellowship, or else she will do some diploma in anesthesia. She can also be an anesthetist, or he can also be an anesthetist.
Okay, sir. And sir, like without you can say the new discovery, the new research, nothing is completed. So what about the anesthesia? What is currently going on in the anesthesia?
Most of the studies, research are going on the anesthesia, and they are helping on each and every day. The medical science is touching the sky. See, earlierly 20, 30 years back, when you heard a disease, cancer, people were getting scared. To be honest, people were scared of touching that type of patient. But nowadays, let me tell you, we have treatments for the cancer. We have a lot of treated patients already in the hospitals who has gone from stage 4 to the normal patient. They have become the normal. From stage 4 cancer, they become the normal. So let me tell you that medical science is doing a lot of technologies and all. Technology also helps. Let me tell you about the recent AI. AI also has an impact, because nowadays we can give telemedication. We can make diagnosis with the AI.
What is telemedicine?
Telemedicine is when you are giving any kind of medicine with the help of technology. When you are introducing any kind of medicine with the help of technology. Understood? In technologies, we are just doing a lot, because all the medical researchers are there. Medical researchers, they do researches. Nowadays, we take biopsies, what and all is there. We can, if any patient, female patients are most prone for the breast cancers and all. Nowadays, with the technology, we can see that the patient is going through cancer before 2 years only. Scans. Nowadays, you see, first X-ray was there, then CT, then MRI. Now PET scan is there. Now working on 3.5 Tesla, which will give you all that things combined together. So medical is doing a lot.
Sir, like as you said that AI is, introduced in this field, anesthesia. Sir, one thing I remember, then there is one cardiologist, okay, and his conversation with one guy, and he said that before, like after doing all the scans, all the CT scan, everything, I am personally checking the patient, the touching on the shoulder, looking on the eye, okay, and like checking the skin and everything. Sir, as I understood that apart from having all the technology, which is like doing way better than us, way better than human, machines are performing way better than, they can calculate the massive data in the second, a fraction of second. But sir, what things actually differentiate the machines and the human? I mean, human sensation have any role in the medical science?
Machine can work only what data you are giving, what software is uploaded, what data you have given, what things you want machine to do, machine will do that. Understood? If you have a calculator in your phone, if you have anything you have, so for example, in your tab you have a calculator. Until and unless you will not put anything from here, it will give you the result. So first of all, basic important is you have to put something. So machines, every technology in the world works on something what you feed on that. So moreover, why humans are important then? As you told, a doctor has to see the patient. It's important because a machine cannot differentiate if this is a skin, until and unless photo if you also see, but it cannot show you whether the blood is passing, what is the color of skin, how pale color, all that differentiations when you have conversation with the patient. Sometimes you must have heard about the psychiatry or the people's in the depression and all. Until and unless you will not have conversation, you will not come to any kind of diagnosis. So machines can give you, if you will write the test, machines can give you diagnosis according to that test. But machines cannot tell you what a human can do. Machines cannot see. If, for example, nowadays it's a time for robotic surgeries. Nowadays we do surgeries by robots. Robots will perform the surgeries. Only you have to do. But still, a doctor, a surgeon has to be there, because who will give inputs what you have to do.
So I think we completed all the questions we get it from our you can say the Google Form survey, Google Form link, and I hope you understood about the today's podcast about anesthesia. That anesthesia has a great role in the medical science. Apart from that, there is a minimum side effect, and you also get to know that how you can become an anesthetic or anesthesiologist. Okay, and sir, we have one small gift for you. So if you want to say anything to our viewers, you can tell.
Just I want to say, I will say only one thing. Just nowadays, in this nowadays world, people's a lot are going through depression, stress, all that kinds of problems, and people's are after a lot of things. Everyone wants to be a big person in life. Just start from zero. If you start from zero, if you start from the lower level, then only you can go into the top level. Otherwise, just simply thinking, depression, over stress, keeping your mind a lot of busy in all that things, so that will be a problematic. Just start wherever you are. Just start and have good dreams. Have the best dreams. Just make one thing in your mind clear. That is, if you are in this world, you are here to help the humankind, help the nature, help the humans. That's it. Because everyone is right now hungry. Everyone is having hunger, kind of hunger for this thing. That is to share the thoughts, to share a kind of good knowledge, to share, because everyone, whatever nowadays you see in the world, it is most of the peoples are going through anxiety, most of the peoples are going into the depression, most of the peoples are going, a lot of traumas are there in the life. So for that, I am telling, just keep all things simple. Wherever you are, start from there, enjoy your life. Don't look at the peoples who are the top profiles. Just look at the peoples who are below that. That is my thing. That's all.
Sir. So we have one small gift we arranged.
Oh, thank you. Thank you so much.
So thank you with having us. Bye. Have a nice day.